All right, welcome everybody. Now, before we get started, quick question. I'm going to post this on Facebook right now. I'm going to do this on Facebook Live. Is everybody okay with that? If you're not okay with that, could you just turn your screen off? Actually, that doesn't even help because you'll still see. Yeah, actually, turn your screen off if you don't want to be seen on Facebook Live.
Hi, Chris.
If you're okay being seen live, that's okay too. I'm happy to be seen live with you.
Oh, well.
And
would you rather us not do the video?
It's okay with me. Hi, Holly.
Okay.
And so I saw Marty and Michael. So there's a lot of people still climbing on board here.
All right, awesome. Awesome.
And some of you have your mutes off. So I'm just going to type on here. So please make sure you have your mute off.
Actually, you know what? Can you make sure that their mute is on so that way we can't hear them?
Is on.
Yeah, so that way.
Can't hear you.
But type in your questions. There's a place down at the bottom of the page where you can type your questions on, or in, I should say.
And some are on their iPhones, so they're not able to do that, I guess.
Oh, okay, got it. We will keep a couple minutes at the end so you can jump back on and ask your questions. So if you guys are okay with that, just kind of hold your questions until the end. And I'll be happy to answer any questions you have.
Okay, let me finish writing that. And then, all right, so I've sent that out. So thank you everybody for joining us this morning. This is Dr. Evan Osar, who I train under and Heather trains under. And the purpose of today's webinar is to give you guys a little more information about balance specifically. And you will learn from today's experience. And I'm really excited about it. And again, go ahead and ask your questions at the bottom of the screen. Put yourselves on mute until we'll leave we'll leave a few minutes at the end for questions and that sort of thing. So Dr. Osar, whenever you're ready, take it away.
Awesome. Thank you so much. Thank you so much for everyone that's joined us. I'm just finishing up, typing this in real quick, and then we'll be ready to go live. I'm going to share my screen with you so that way you can see my screen. We're going to go through a little bit of a presentation just so you can really understand why these three things, or how these three things, balance, breath, and brain health, can be trained, and also how it can be impacted right away and long term with the right training. So let me just get back to my screen here. So now I'm going to share my screen. So just let me know when you guys can see my screen. Hopefully you guys will be able to see this. Can everybody see my screen? Just give me a thumbs up. Perfect.
Okay.
Awesome, awesome, awesome. All right. Your 3 keys to health and longevity. This will help you also understand a little bit more what Julie and Heather are teaching you during their training programs, because there's a lot of, in our industry, they know that there's a lot of misconception about how simple things can actually make a profound difference. And you know from your own experience that when you eat well, hopefully you know this from your own experience, when you eat well, it makes a profound difference in how you feel. Well, how you breathe, how you balance, and how you train your brain can also have a profound impact on your health and longevity. So we're going to share with you how that can happen. I'm going to have you go through a specific exercise with me here, so that way you feel the difference. And this should be familiar to you if you worked with.
Did you get what you need?
Heather and Julianne. So I'm going to, hang on a second. I'm just going to mute you guys just for a moment. Let's see.
Harry, if you could put yourself on mute, please.
Thank you. Should be able to mute you guys from here, but I can't actually see how to do that. So we will, just kind of mute yourself if you could, please. Okay. Now, I want to share an experience with you, an individual who went through this exact process. This is LILIAN in the middle of the picture here. This is my friend Jackie Bachmeyer, who's also come through our certification program as well. She owns Evolution Health and Fitness, or Fitness and Wellness, down in Houston, Texas. LILIAN came to a talk I gave back in May of last year. And then I was back there in September. I have a sister that lives in Houston, so I'm down there quite frequently and coach with Jackie as well. So she said to me, she came up to me and she's like, Dr. Osar, I just want to say I was at your presentation in May, and what you taught me about the foot was so profound. I had a history of falling and walking with a cane. And she was in physical therapy. And when hurricane, I forget the hurricane that went through Houston, I think it was, I don't even want to say, because I don't want to say it wrong, but the hurricane that went through in 2000, I believe it was 18 now, she basically lost everything. She lost her house, she lost everything. So she was stressed out. She was, like I said, fearful of falling, fearful of what was going to happen for her future. She was doing rehab at a local hospital, and she found Jackie and started to train with Jackie. And Jackie was trained in the same principles we're going to share with you here, the Integrative Movement System principles. So she came up to me and said, you know what, Dr. Osar, I walk without a cane now. I don't have a fear of falling. I can exercise. I can go to and from the gym. I can go to and from getting my groceries. And she was so excited. You see the smile on her face. She was so touched by the work that I shared with Jackie, but more importantly, the work that she did with Jackie. So this does work, and you can really, we believe as integrative movement specialists, you can change people's lives with this information. And especially now when so many of us are locked in and we're fearful for our health, we're fearful for our future, our finances, our family members. This is very important for you to take control of the things that you can control. Exercise is one of those things. Nutrition is one of those things. Your mindset is another one of those things that you can control and stay on top of right now, regardless of what's going on out there, because you can't control what's going on out there. You can only control what's going on with you. So I started out as a personal trainer, and then I went to chiropractic college. And I developed the Integrative Movement System along with my wife, who's standing next to me in the picture there, our full-time Integrative Movement specialist, Sarah, and Jill Leary, who was a student of mine in massage school over 20 years ago. Now she works with us in our clinic as well. Obviously, before we were in isolation, but this is our team of individuals that works with me. And I would say your life is oftentimes a reflection of how many great women you have in your life. I'm blessed to have 6 sisters, even though sometimes they drive me crazy. I work with only women, not because I choose to, but I'm just fortunate that I do. And so if you have a lot of good women in your life, things are good. You know, we get lovely people like Julianne and Heather that come through our programs. It's mostly women. We have men that come through too, but it's mostly women. Very, very blessed to have a lot of great women who support, educate, empower, and make me a better person. Now, I wasn't always that way. So after chiropractic college, I graduated 22 years ago. I moved to Chicago. I'm originally from New Jersey. I started work I went back to personal training because I wasn't making very much money in my first job. So I started training at the East Bank Club of Chicago. And if you look at East Bank Club, these pictures here, you can see that this club is a city block long. It's 4 stories high. If this is a cardio room here, so I'm gonna move this picture here so you can see it. That is a cardio room, 300 pieces of cardio. Now, at the time, I was a young stud, or I thought it was pretty cool, but I wanted to work with mostly athletes. Michael Jordan worked out there. Oprah worked out there. You know, a lot of the Blackhawks and Bulls players, the professional athletes worked out there. This is who I wanted to work with. Now, they knew I was a chiropractic physician, so that's not who they gave me to work with. They gave me these individuals to work with, the people that had knee pain, the people that had back pain, the people that had spinal stenosis, the people that had balance issues, the people that had walking issues. And that's who I was working with. And I quickly realized I wasn't prepared to work with these folks. Like, even with all my education, 10 years of college, I had about 5 years of personal training experience, and I couldn't work with these people. I didn't know what to do, so I was very frustrated. So I began going to lots and lots of seminars. So I had already spent $150,000 on my education. This is 1998 when I graduated. So that's about $300,000 in today's dollars. I went back, I spent thousands and thousands and thousands of hours and dollars, tens of thousands of dollars on my education. And what I quickly realized was most of the education I got wasn't specific to working with these individuals. Because what I was hearing was you need to train these people with high level, high intensity exercise. And I kind of believed that until I started having injuries myself. And that's a topic for another day, but I got serious shoulder injuries. And that really frustrated me because I was spending so much time and energy in education trying to learn about how to treat people right, how to train people right, how to rehab people right. And I was physically breaking down when I was at the prime of my life, back in 38, physical prime of my life, back in when I was 28 and 30. So this system that we developed, the Integrative Movement System, came out of the frustration of my own shoulder problems, my wife's chronic 20-year history of migraines. Sarah, our Integrative Movement Specialist, she has a dance history of dance-related injuries that happened also after she had a C-section. All these people that we started to work with and started to see results with, that's how the Integrative Movement System started. It didn't get started working on athletes because we saw very few athletes at the time. But now when athletes come and see us, guess what we do with them? We're going to do the exact same thing with them that we're going to share with you here in this program. What I realized quickly on is you can't train these folks like you train the younger population. I don't care what people tell you, you can't. If you try to do that, you will start to get a lot of injuries and or exacerbate things that you've had going on for a long time. That's why it's so important that you work with a qualified individual. And that's why we're out here putting out so much quality education, especially now that we're all on lockdown, and this is a good time to up-level the education. We want to bring education to the health and fitness professionals. However, we also want to educate you as the general population about things you can do and be proactive with. So we're going to share some of those very important things with you here today. As I said, we train individuals just like Julianne, just like Heather, just like my friend Jackie I mentioned before. These are just a group of our integrative movement specialists, and they're posture and movement specialists. This is not a weekend certification. This is not just take a test and you get certified. This is a year-long intensive program, and these individuals also come back yearly for more education. They actually get monthly coaching with us as well. So these are the elite of the elite health and fitness professionals if you're looking for somebody to work with that understands how to work with complicated issues like posture, like movement, like chronic tightness, like spinal stenosis, like before and after joint replacements. Now, I want you really to pay attention to this picture right here. And I see a smile on someone's face there. This is, this is what most of us look like at one time in our life. And I really want you to appreciate what you see here, because the reason why you're smiling is because you realize, like, wow, this is what we were all designed to be like, where you see the head perfectly aligned over the ribcage perfectly aligned over top the pelvis. And without life getting to us, this is how we would stay pretty much our entire life. And you see this cute little baby looking down at her toy cell phone, which will very quickly be a real cell phone. And then life will start to get to her. But you see the beautiful alignment, and you see her little belly here, and she can do beautiful breathing. We'll talk about that because she's done everything that her nervous system has taught her to do, and she hasn't been influenced yet by what the outside world is about to do to her and teach her, okay? So I want you to keep this in mind as we start to look at what happens to us as we go through our lives. You see the beautiful alignment of the spine over top the hip joints. Now, what's different between the little baby and my patient here who has got chronic low back issues, chronic balance issues, chronic poor ability to walk? Big, big difference, yes? You no longer see that beautiful alignment of the head over top the thorax, over top the pelvis. Doesn't mean he's not a beautiful person. It just means his alignment has changed and changed dramatically. That didn't happen overnight. There's a series of things that happened to him, a series of habits that he adopted. It wasn't genetics. It wasn't his parents' fault. It wasn't his boss's fault. It wasn't his genetics. It was what he did through the course of his life that took him from what he used to look like as a child to what he looks like now. Each of us has our own history, our own physical history, our own mental history, our own medical history that changes and ultimately drives and dictates how we look as older adults. We can see the changes that happen. The head comes forward, the shoulders come forward, the rib cage becomes compressed, balance starts to change, breathing starts to change, strength starts to change. And these are the things that ultimately drive us to have chronic tightness, discomfort, and just not be able to perform at the levels we need to or want to. But there is great news. There's things that you can do that are within your control to change these habits and start to create those more optimal habits that take us closer back to where we once were when we were children. So What I'm trying to say to you is we developed habits over the course of our life. Many of us lived sedentary lifestyles. We went to school and sat in desks in school for many hours a day. We went to college and sat many hours. We went to jobs, sat many hours. That started to change our posture alignment. We had things like stress and trauma and injuries and surgeries and broken bones and joint replacements. All these things started to change our posture and movement. Essentially, life happened to us. And maybe we learned things from well-meaning parents, teachers, and coaches that told us things like stand up tall, pull your belly button in, squeeze your tushy, squeeze your shoulder blades down and back. Some things that also create non-optimal and inefficient posture and movement habits. And we'll discuss a little bit of the things, some of the things that you can do, like I said, to start to move you closer to what's more optimal. Now, this is very important because right now we're sort of in a weird world where people don't really like to take responsibility for their actions. They like to blame other people. They like to, want other people to solve their problems. The one thing that you can do, the most important thing that you have control over is number one, your mindset. That's the one thing that no one has control over except for you. You have control over your mindset and the actions you take based upon your mindset. And responsibility is the price of freedom. I love being in the United States. I will never complain about my country, even those things I don't agree with. I'll never complain because we have full responsibility and we have full opportunity to do anything we want within reason, obviously within the laws. So please take this seriously. Responsibility, your health is your responsibility, and this is the price of freedom. Your doctor is part of your team. Your health and fitness professional is part of your team. Your nutritionist is part of your team. Ultimately, the responsibility is on you for your health and well-being. The number one thing you can do for your health and well-being, besides understanding that concept that I just shared, the number one thing you can do for your health and well-being, bar none, is breathing. Breathing is the most important thing that you can do. And just like you may not have great balance, you may not also have great breathing. Because people will often come in to say to us as as integrative movement specialists, but I already breathe. I breathe all day long. Why do I have to work on breathing? But that's like saying, hey, you've been walking your entire life. Is your walking getting much better or any better because you've walked your entire life? And the answer is no, your walking hasn't gotten better. You work on your walking to make your walking better. You work on your balance to make your balance better. You work on your breathing to make your breathing better. So I hope that makes sense. So here's why breathing is so important. Number one, obviously, it's gas exchange. That's how we stay alive. But it's also breathing, your breathing muscles, your diaphragm, that muscle that's right in your rib cage here. I know Julianne and Heather have talked about this. It's your number one postural muscle. It's like blowing up a balloon inside your rib cage and your abdomen. And that's what keeps you upright. It's not just muscles. It's the ability to control pressure inside your cylinder, inside your rib cage and your abdomen and your pelvis. So your diaphragm, your breathing muscles are your posture muscles as well. It also helps you maintain mobility. So when clients come in here and say to me, hey doc, my back is really tight. The first thing I say to them is like, yeah, you're probably not breathing well. Because when you breathe well, when you use your entire rib cage, your entire spine, your entire abdomen and your pelvis in the breathing process, you don't get tight. But when you don't breathe well, you get really tight. Your neck muscles get tight. Your shoulder muscles get tight. Your back muscles get tight when you don't breathe well. Because when you breathe into your entire cylinder, as we'll talk about and I'll take you through, you will not get tight. So how does breathing impact balance? Let me move this out of the way so you can see. So there's a study that came out in 2018 and they looked at individuals that had good breathing and individuals that had surgery on their rib cage. And what they looked at is the people that didn't have surgery and had good breathing and the people versus the people that did have surgery and not so great breathing is the people that breathed well, they had better balance. So breathing is the number one thing you can do to improve balance. Because remember I said, think about a ball. Think about the soccer ball that this little kid's kicking right now. If the soccer ball is deflated, the ball just collapses. When you're not breathing well, your rib cage and spine essentially collapse. When you breathe well, it's almost like blowing up that balloon. Your rib cage and spine get longer, and now they don't collapse. So if you're not working on your breathing, your balance will be compromised. Now, here's another thing that just came out in the research as well. When you don't breathe well, you get atrophy. That means the muscles get smaller and weaker, and you get muscles of respiration get smaller and weaker. So just like any muscles in your body get weaker when you don't use them, same thing with the diaphragm. You get 30% decrease in strength, meaning like you lose strength in your breathing muscles. And this is why it's so important to understand why breathing is so important, is because these muscles get weaker. And if you look at a lot of older individuals, they struggle with breathing, especially if they haven't been breathing well for a long time. Okay. It also leads to increased stiffness and fall risk. The stiffer you are, the more likely you are to fall. The stiffer you are, the more likely it is that you are not breathing well. So again, it just becomes a self-perpetuating cycle. You don't breathe well, you become stiff. You become stiff, you have a risk of falling. You have a risk of falling, you become stiffer because you're trying to protect yourself and not fall. The stiffer you become, the more likely you are to fall. So I hope this is starting to make sense. Just give me a thumbs up if it's starting to make sense to you guys, why breathing is so important. Thanks, Julianne. Yeah, awesome. Thank you, guys. I appreciate it. Now, how does this impact posture and movement? Well, first you get sarcopenia and balance issues. Sarcopenia just is a fancy word that means your muscles start getting weaker. They atrophy and get weaker. And that's why so many of us struggle with balance and posture and movement as we get older. It's happening to us if we don't work at it, but we can reverse it. That's the great thing about this information is you can reverse some of these changes. We get balance issues as we talked about, but you also get cognitive decline. Before the coronavirus came around, do you know what the biggest concern of older adults was? It used to be finances. Living longer than their finances, your finances would last. But it was quickly replaced in the last few years, but more older adults are afraid of losing their cognitive ability. So one of the things you can do for your cognitive ability, number one, is exercise. Breathe right and exercise, because that's how you start getting proper gas exchange in your brain and blood flow to your brain. That helps your brain. Exercise has been shown, many exercise, resistance training, Tai Chi, yoga, novel training that will show you here later on has been shown to improve cognitive function. So please get exercise as much as you can. As much as you can leave your house. If you can't leave your house, please, yeah, obviously don't leave your house. But if you can, go for a walk. Even if it's a 5-minute walk. Walk around your block, come back, go back in isolation. But do some exercises every single day. Get movement every single day. Now, let's talk about breathing, because we're about to get into having you guys go through this. We've all been taught, every one of us, myself included, that you should be belly breathing. Give me a thumbs up if you've been taught belly breathing sometime in your life. Yeah, we've all been taught belly breathing. But belly breathing is not proper breathing. So I want you to see my patient here who's got chronic low back pain, chronic balance issues. What you're going to see, he's breathing, he's belly breathing. You see the big belly breathing right here. And when he breathes out, you see no motion in his rib cage. Remember I said that you have to use your entire rib cage, abdomen, and pelvis. All he's using is his belly. Belly breathing is non-optimal breathing. That will create stiffness and perpetuate stiffness. That will create weakness of your abdominal wall. We see it in all our clients. I should say most of our clients will show some signs of non-optimal strategies because they're mostly belly breathing. I'm going to show you how you get your breath into more of your rib cage and your spine, into your entire cylinder, just like we used to do when we were babies. And again, here's another great example of what we used to do as babies. Here's my little niece. She's 10 years old now, or she'll be 10 years old here in a couple months. But you see the beautiful alignment. Again, you see this alignment here? If I put her down on her back, that's what she looks like, right? It's the same alignment, whether you're lying down or you're sitting up. And if you look at these women here carrying massive loads on top of their head, these skinny little women carrying massive loads on top of their head, how do they do it? They don't have big muscles. Look at the scrawny little arms here. Look at the scrawny little ankles here. They don't have big muscles, do they? It's not muscles that will make you better. It's how you're using, I should say, yeah, if you get more better muscles, yeah, you'll be stronger, for sure. But it's not just about muscle strength. It's about how you're using your body. Because I could take the strongest, baddest athletes in the world and put a massive load on top of their head. They would have neck pain very quickly. It's not strength. What do they do very well? These women that allow them to carry these massive loads, they do 3 things very well. What do? They align very well, they breathe very well, and they control very well. That's exactly, I know this is what Julianne and Heather are teaching you during your exercise. It's the exact same thing that allowed this baby to be in this position and my little niece to be in this position and allowed all your great athletes that actually are aligned and controlled well. It's what allows them to have proper stability. And as I said, it comes from breathing, aligning your joints in the right position and then breathing well. I'll show you how to do that in a moment. And this is where the principles of the integrative movement system come from. You see my little niece here in the happy baby position. I know Julianne and Heather have used that position with you. I know they've used the plank position here with you as well. And if you look at my little niece, that perfect little plank, do you see that perfect little alignment here? She's in a plank position and she still has that beautiful alignment. Here she is starting to learn how to pull herself upright. And what do you see? Again, that perfect alignment. It does not change. She uses that perfect alignment all the time. And if she continues this for the rest of her life, she will have a great strategy for posture, for movement, and really decrease the likelihood of having arthritis and all those things that most of us suffer with. Now, hopefully she will not change these things, and hopefully she'll take my advice. But you know what happens when your uncle tells you something or your parent tells you something, you don't always listen to them. But right now, she's pretty solid. Okay, now I want to share a story with you. This is my good friend, Debbie. Debbie has been a patient of ours for about 10 years. She came to me actually on my birthday, which is kind of ironic because the first day she came to my office was my birthday. But she is like many of you. She had a fused big toe. She had bilateral hip joint replacement. She has cervical and lumbar spinal stenosis. She's got balance issue. Like when she turns her head, this is what the cervical driven balance issue means. When she turns her head, she loses her balance because of spinal stenosis in her neck. She's got pulmonary lung disease. She has aortic valve stenosis and maybe needs valve replacements. So this is very much like many of you that are watching this or listening to this, that she's got multiple health conditions. Now, I want to also stress to you that Debbie has done everything we have asked her to do, relatively speaking. You know, she's human. She's got a job. She's got a life. But relatively speaking, she does every single thing we ask her to do. She's still coaching with Sarah Fisher, our integrative movement specialist. She's still doing her once a week sessions. She's still doing her exercises, even though she's in isolation. So she's immunocompromised. So she was in isolation before this ever started, the forced isolation, but she's still been active with her exercises because this is such an important part to her health process. And I'm very grateful for her to allow me to share this story with you guys. Now, I want you to show you why belly breathing is non-optimal, because I don't want you to take my word for it. I want to show you why this is non-optimal. Belly breathing will cause issues. Now, I want you to watch your abdomen. What should happen when you are lying on the floor on your back and lift one leg, what should happen is your abdominal wall, abdominal muscles should contract, and you should stay nice and steady. You should not see any distension or bulging of the abdominal wall. You should not see any movement of the pelvis or low back. I asked Debbie to lift her leg up and watch what happens. She lifts her leg up. Watch my arrow. You see how her abdomen bulges up? Yes. And you hear, she's like, what are you looking at? You're like, this? I'm like, yes, this is what we're looking at. Let me show you again. So she lifts her leg up, and you see this bulge right there. And this is what happens. This is a direct result of having surgery, abdominal surgery, and also being a belly breather. It stretches out your abdominal wall. It weakens your abdominal wall. It weakens your diaphragm. It weakens all the muscles around your spine and pelvis when you don't use it in an optimal manner. And then when you start to put a load or resistance into your body, you don't activate that abdominal wall well or your core muscles well, and you start to bulge out. And that's why so many of our older clients have that distended abdomen look, even though they're not super overweight, okay? So it's not just about being overweight. It's about how you're breathing and how breathing impacts your core muscles. They are linked together. I'm gonna show you exactly how to change that. So I'm gonna do that actually right now. So what I want you guys to do with me is I want you to actually stand up. If you're watching this, I want you to stand up. We're gonna do this together. We're gonna do two things. I'm gonna show you two exercises. We're gonna stand up, we're gonna check our own balance. But here, and if you have a balance issue, if you know you have a balance issue, you can stand next to a wall and use a light hands on the wall. I'm gonna turn around just so you can see what I mean by that. I'm gonna angle this up just a little tiny bit. So let me just see if I can get this screen angled up, because I want you to feel the difference, not just hear me talk about it, but I want you to actually experience the difference. So if you have a balance issue, you can put your hands lightly upon the wall like this, okay? I'll turn around here. What I want you to do is stand with your feet together. But again, if you have a balance issue, just be next to a wall so you can put your hands on the wall, not to the side like this. Just face the wall so your hands are actually on the wall, kind of like this. So just with a light grasp. What I want you to do is look straight ahead, lift one leg off the ground, bring your knee up towards your chest, and hold your balance. And see how that feels to hold your balance. How much effort are you using to hold and stand on one leg? Just get a sense of that feeling, okay? Then put your leg back down. Stand on your other side. Same thing. Hold, balance, put it back down. Check both sides. Again, one side, lift your right leg up, or lift your left leg up, hold, feel your balance, and feel the balance on the opposite side. What I want you to pay attention to, a couple things. You can have a seat now. Everybody have a side that was a little more challenging to stand on. Did everybody feel a little difference on one side? Like maybe a little different, a little bit harder to stand on? Yep, everybody has a side that usually has a side that's harder to stand on. Maybe both sides are challenging, but one side is a little bit more challenging. So I want you to pay attention to that because I'm going to show you how to change that. Okay, now there's things we would do before we did breathing, but I just want to show you the power of breathing. Now, if you notice, my client Debbie has a strap wrapped around her rib cage. This is where most of us need to learn how to breathe, not into our belly as we talked about. We need to learn how to breathe into our rib cage. So what I want you to do is put your hands on your rib cage right here, side to side. You can sit down, but put your hands on your rib cage. I just want to show you where my hands are. So they're on my rib cage, right below my chest, side to side. Okay. Now, if you have a strap, you would use a strap. You can use a yoga strap. You can use a resistance band. You can use a bathrobe strap. Use a strap from your bathrobe. But right now, we'll just use our hands. Now, most of us, like I said, we're belly breathers. So let me show you what that looks like. But when we're breathing like this. We're breathing too fast and too low into our belly. What I want you to focus on is breathing through your nose. Most of us are mouth breathers as well. And we need you to breathe through your nose. The reason why nose breathing is so important is number one, it warms. Number two, it moistens. Number three, it filters. You want to warm, moisten, and filter the air. You do not want to be breathing through your mouth if you don't have to, okay? So the other thing that happens with our breathing is way too fast. When you don't breathe well, you start breathing very, very fast. That means your muscles are working harder and they're becoming less efficient, okay? So hands on your rib cage here. Sit towards the edge of your chair if you can. So wherever you're sitting, sit towards the edge of your chair. I want you to breathe into your hands through your nose. Okay, so breathe into your hands through your nose. Pause. So we're going to breathe in for a count of 2 and then pause and then breathe out for a count of 4. I'll count 4, 3, 2, 1. Pause. And now breathe in again for a count of 2 and then pause and then breathe out for a count of 4, 3, 2, 1. Pause. Breathe in again. Count of 2 and breathe out for a count of 4, 3, 2, 1. And one more time. And as you're breathing in this time, I want you to really focus on your hands expanding this direction as you're breathing. And breathe out and feel your ribs relaxing back down as you breathe out. So you breathe in, expand, breathe out and relax your ribs. And then relax and breathe normal. Go back to your normal breathing. So we're going to do that again, but I just want to show you that's how you start to create better breathing into your rib cage. And when you leave here, and Julianne and Heather are working with you, use a yoga strap like my client is doing here. So I'm going to play this video, but she's doing exactly what I'm teaching you guys to do right now. The strap is here. You won't see much happening because you won't see her back expanding a lot, but she's breathing into the strap. It provides her feedback to let her know that she's breathing into the strap, okay? So we're going to use that same strategy one more time. So again, sit at the edge of your chair again, or just reposition yourself again. Stay long, like you're being pulled up from the back of your head and neck. So back of your head and neck, hands on your rib cage. Let's go one more time. Let's breathe into your rib cage for a count of 2. Pause for a second, and then breathe out for a count of 4, 3, 2, and 1. Pause. Breathe in again into your hands for a count of 2, and then pause, and then breathe out for 4, 3, 2, 1. Pause, and then one more time. Breathe in, pause, and then breathe out for a count of 4, 3, 2, and 1, and then relax. The reason why we use those pauses is it slows down your rate of breathing. So we did a 2-second inhalation, so that's 2 seconds. We did a 1-second pause, that's 3 seconds. We did a 4-second exhalation. Now we're up to whatever my math is, 7 seconds. Wait, 7 seconds, yes. And then we did another pause on 8 seconds. So we did an 8-second breath. You want to make your breath at least minimally 8 to 10 seconds. That's how you create a longer breath and use your muscles more efficiently. And that's how you strengthen your breathing muscles efficiently, okay? Now, that's part one. Now, we also need to use it in other positions. Now, before we get to checking our balance again, let's talk about feet for a quick minute. When we were young, when we were babies, our feet used to work the way they were supposed to because their feet were cute little things like this, and they weren't shoved into shoes that didn't fit and shoes that were fashionable and shoes that were cool or trendy. And if we didn't mess our feet up, then our feet would look like this, nice, healthy looking feet as adults. Now, I just want to show you what our feet should look like. What do they should look like? This is what feet should look like. If you look at native cultures that don't wear shoes like we do, this is what the foot looks like. If you notice, what do you notice about this? The toes are straight. The toe and feet are wide. The foot is nice and wide. And if you look at the foot here, you see how wide that foot is? Looks very different than your foot and my foot, right? Unless your foot looks like this, which is great if it does. My foot does not look like this. I was a Catholic schoolboy, so we didn't have a lot of money growing up, so we had to wear dress shoes, and all the dress shoes were little pointed shoes. And I would wear shoes that were too tight because my parents didn't have money to buy me new shoes, so my foot looked like this, okay? Like many of us that wore shoes that were too small and maybe trendy. Posture and balance began not just with breathing, but it also began with the foot being in the proper position. Now, I want to show you what happened to people's feet when they got shoved into shoes that were too small. One thing we'll talk about before we get to the next picture is we'll talk about the foot tripod. The foot tripod means most of your weight underneath your foot should be underneath your big toe, your small toe, and your heel. And I know you've heard this from Julianne and from Heather. Okay? Now, let's look at what the foot looks like when you shove them into shoes for many, 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 many years. That's what feet look like. And now that's a little bit, my feet don't look exactly like that, but they look closer to that than they do the other foot, except now my feet are looking more like the other foot because I've been working on this so much. But do you notice how this foot looks exactly like the shape of the shoe? This is not how he was born or she was born. The foot shaped to the shoe. And that's what's happened to the majority of us. If you're not wearing the right shoes, you will not have the right foot, and your foot will not be able to get on that foot tripod. You will not be able to use your foot muscles properly. And just like the muscles up here that will atrophy and get weaker with age, your foot muscles will also atrophy and get weaker with age. It's not genetics. It's not because your mom had bad feet. It's because mom probably had tight shoes and you probably have tight shoes. Okay, cool. Make sense? Just thumbs up. Cool. Yes, ladies? Yes? Good? Yes, thank you. This is my client. He came in. Do you notice his foot position here? He's like, my foot really hurts. I got toe pain. And what do you notice about his foot? It looks a lot like what? The shape of his shoe, yes? Looks exactly like the shape of his shoe. That was before we worked on it. This is me. This is him 15 minutes later. I did some specific release with him. I taught him how to use his foot muscles, and his foot started to change in 15 minutes. Now, it won't stay like that unless he does what? Unless he goes home and does his exercises. There's no magic that I do. I mean, maybe I do a little magic, with my fingers, but it doesn't last unless he goes home and does his homework. So he has to do the homework, and he also has to get rid of these shoes because they will not help his feet, because his feet will just go looking back like that. There's nothing he can do exercise-wise to undo what this shoe will do to your foot, okay? Now, if you look at my shoes here that I'm wearing, let me move this screen here. These are shoes that are not good for your foot. These are shoes that are good. Do you notice how much wider this gym shoe is than this gym shoe? This is what I used to wear. Because I didn't know any different. I'm like, okay, this looks like a cool shoe. But now this is a shoe I wear because now this allows my foot to be wider. Another product I use, I'm not telling you to go get this product, but my friend and podiatrist, Dr. Ray McClanahan, he is the developer of Correct Toes. You see this little device I'm putting in between my toes. I am not telling you to go get that and that you need that. I'm just telling you that is what I use, and we're starting to use it with our patients, and we're having good results with it. Because what it does is it allows you to spread the foot out and you allow the foot to be wider like you saw in the more primitive type foot, or the foot of what we should all look like. And this shoe right here allows my foot to be wider, and you see me wearing that shoe there. Again, you can check out his website, Dr. Ray McClanahan's website. He is a podiatrist, correcttoes.com. I make no money by telling you any of this. I just share good information from people I trust, I like, and are doing great things in the industry. Now, what can you do about your feet if your feet are more like mine used to be? Now, I'm using a little bit, you can see this little device I'm using, the activator. You may have seen Julianne and or Heather use this device. You can also use a ball. Here's what you do not want to do. We see a lot of people put their foot on the ball and they just go like this. They're, oh, just going to do something, and they're not very specific about what they do. I want you to be very specific with what you do with your foot, okay? So you want to roll over your foot or just put pressure on your foot. The only area of your foot you never want to put pressure on or underneath is directly underneath your big toe. So right here where my pointer is, hopefully you guys can see the pointer, right underneath your big toe, there's two little tiny bones there called sesamoid bones. Don't ever push on those bones. So you can work anywhere in the foot except for those two little sesamoid bones. Now watch what I do. So you'll take your tennis ball, you can use a lacrosse ball, you can use a racquetball, use any kind of ball. You know, if your dog has a ball, use that ball, even though the dog may try to get it away from you. What I want you to watch is I'm not just going like this. I'm putting my foot down, putting pressure and holding it for about 5 seconds, and then I release and then use another area or go to another area of my foot. And I push down and hold for about 5 to 10 seconds and then go to another area. My big toe is not on directly pressing down. It's right behind my big toe, but it's not underneath my big toe. And I'm releasing and holding. And now I'll put it down through the middle portion of my foot. So my foot is spreading out this direction because we want to create that foot tripod, which is a wider and longer foot than most of us have. The cool thing about this is it works whether you have a flat foot or you have a high arch foot like I have. If you look at my arch here, super high arch foot. So, but what's cool about this is it works whether you have a flat foot or a high arch foot. So again, hold it for 5 seconds. You can lift the toes up and then put your toes down. Just working the foot muscles. It takes maybe 2 to 3 minutes at the most, but you have to do it every single day, okay? Now, while you're sitting there in your chair, what I want you to do is if you have very tight shoes on, you may need to pop your shoes off to allow your foot to spread out. Because what I want you to do is, even though we're not going to release our foot right now, I want you to put your feet on the floor and spread your foot out as much as you can. And even if it doesn't go wide, just visualize the foot going wider. Your brain is a very powerful tool. Just visualize the foot going wider, and the muscles, your brain will start to wake up the muscles in your foot, okay? Think about your toes going longer, so lengthen out your foot, okay? Now, lean forward in your chair to put a little more pressure onto your feet. So lean forward, so you're putting a little more pressure on your feet, and now lean back, release, okay? Just visualize the foot going longer and wider, lean forward, reach those toes long, and then reach back, or sit back, I should say. Sit forward, and then sit back, okay? So hold that. Now what we're going to do, and Debbie's going to demonstrate this for us, and she'll demonstrate it really excellently, is she's going to do a hinge, a seated hinge. Do you notice how she's maintaining her alignment and hinging from her hip where the pointer is right there? She's not rounding her back. She's hinging from her hips, keeping the feet nice and flat on the floor. She makes sure her neck is nice and long. So you see her checking her neck, and then she stands up, okay? So if you have knee pain, you don't need to stand up. If you don't have knee pain, I would like you to stand up from your chair, okay? So let's do this together now. What I want you to do now is keep your feet wide, so about shoulder width apart. Hinge forward and then stand up. And then hinge to sit back down, okay? Hinge forward as Debbie's doing, and then stand up. If you have knee pain, you don't need to stand up. Don't cause knee pain, okay? But use your hips, not your back, to stand up. And then come back down. If you have back pain, just keep hinging forward and then back. Forward and then back. You can still get the same result, just like Debbie's doing right there. Just get that weight over your foot. Use that foot tripod and relax, okay? Now, what I want you to do now is recheck your balance. So stand up again. Go back to where you did your balance. If you have to hold the wall, that's good too. But just check your balance. What I want you to do is just lift one leg up, hold your balance, feel how that feels, put it back down. Other side, lift your foot up, balance, put it back down. Alternate each side. See if your balance is any different. Does it feel a little bit different, a little bit easier to stand, a little bit more balanced? And I love Joan. Joan's like, thumbs up. Yeah, it does. Isn't that crazy? Isn't that crazy how different your balance can feel by the little tiny bit of things that we did? It doesn't take a lot to change balance. It doesn't take a lot to make your brain and body start to work better together. You just have to be consistent. Thumbs up to anybody that did feel a difference, even a little bit of difference. Cool, awesome, thank you. Okay, now, you do have to make it more challenging at some point, okay? So here's me working with Debbie, and she's now gonna demonstrate what a more advanced balance pattern. I'm cueing her to stay long and step onto a balance pad, so her foot's a little bit wobbling now. She's still maintaining her foot tripod. I'm still cueing her to stay long and still cueing her to breathe into her rib cage. She's doing a great job, and it doesn't look hard, but that's hard for Debbie. But she's doing a great job maintaining that balance as her foot is sort of wobbling, as her body's wobbling. She's maintaining that nice alignment, and then she steps back off of it. So again, this is a little bit more of a challenge than just standing there or just doing a squat or a hinge. Now, the third thing that we're going to talk about today and finish up with is brain health. One of the best ways to increase brain health is what we call dual task, doing two tasks at the same time. Most people don't fall just standing there. They fall when they're carrying something and they go to turn, or they're carrying their food and they don't want to spill the food, and they go to maneuver around their coffee table and they fall, or they trip, or get their feet caught. So here I'm teaching Debbie how to maintain her alignment, how to maintain her breathing, and also to dual task and catch a ball. If you look at some of the best balance programs, this is what we want to move people towards, is combining a dual task, catching a ball, or reading something as you're balancing, as you're walking. You want to do this inside your house, and since we're all locked in our house right now, this is a perfect time to work on this. So if you watch, I'm throwing the ball to Debbie, and she's maintaining her alignment as she steps and catches the ball. And again, she makes it look very easy, but this is not easy for Debbie, but she makes it look very easy. And I'm trying to get her to use her eyes, not move her head, because when she moves her head, that's when she loses her balance. So move your eyes, Debbie, not your head. Maintain your balance. Step, foot tripod, catch the ball, maintain it, and she's doing an excellent job with that. Awesome. So you could just have a ball in your hand and then just stand up and just throw the ball up to your other hand, catch it in the other hand, throw it, catch it in the other hand, and just maintain your balance. That may be your balance challenge. It doesn't have to be complicated. It just has to involve some coordination, some brain some thinking, and you can make it as fun as you need to or as challenging as you need to, okay? So you get the brain, you get your balance, you get your feet working as well, you get your breath also working as well. And that's ultimately how you create health and longevity. Brain health helps improve posture and movement. Posture and movement helps improve your breathing. Your breathing helps improve your mindset. And when you add that with your nutrition and your relationships, you have the plan for health, longevity, and really, like I said, the most important thing I want you to take home from this is taking responsibility for the things that you can control. The easiest things you can control are your mindset and the actions that you take, the habits you create around your mindset, and doing the things that are proactive to help keep you healthy, help keep you strong, and help you elongate your life. You know, live a long, great life, and you can do it by taking control. So I hope you guys enjoyed this. Give me a thumbs up if you had learned some great information, if it reinforced some of the things that Julianne and Heather talked about. Awesome, thank you so much. And let me see if there's any questions. Let me just pop off of here real quick. Let me just jump over here and see if we can answer some questions now. Let me get off of here. Sorry, I just have to get off of here. Hang on, let me stop the share. All right, let me see if there's any questions. Any questions? Go ahead, type them in. Oops, oh, no questions. All right, cool. Any questions? You guys can unmute yourself and just
or
kind
maybe
of.
take it off of mute, some of you. If you have any verbal questions and you can't type it in, if you're on your iPhone or your iPad and you can't type it in, you can take it off of mute and ask your questions.
And thank you. I want to thank each of you for being on. I know You got a lot of things that you could be doing and paying attention to. I really appreciate your time, your energy, your attention, and really participating for actively participating, because it was fun to do that with you and notice your changes as well. Julianne, do you have any questions that commonly come up?
Not so much. I would like to thank you so much for your informative lecture. Even I learned a little bit today up and
Cool.
beyond what I already know. So
That's
every
awesome.
time I work with you, Dr. Osar, I learn something.
Cool.
And,
Thank you.
you know, so I appreciate it. I appreciate your time, and I appreciate all of you jumping on with Dr. Osar, Heather, and myself. And if there's any further questions, you know, Dr. Osar will be happy to answer those for you. If you want to verbally ask, just take your mute off and you can verbally ask, or you can type in your questions to the right of your screen. And if some of you have questions that you think about later on, just email me or Heather at yourmovementsolutions at gmail.com. Sorry, I had to think for a minute.
All good.
And or call one of us, and we'll certainly, if we can't answer it, Dr. Osar has the answers. So again, we'd like to thank everyone for hopping on, and we'd like to thank Dr. Osar. Your time is valuable, and we appreciate it.
Thank you, Heather. Thank you, Julianne. Truly appreciate all you guys are doing for your community, for our industry, and spreading the message, the positive message of the integrative movement system, and really being a leader in the industry, because right now we need leaders. We need people that are empowering people to maintain their health, because that's the best chance we have. Isolation and keeping a positive mindset, and then taking care of the posture and movement issues that will keep us strong, keep us healthy. And when we come out of this, get out there and be active again, but still stay active now when you're in your houses. So thank you so much. Again, if you have questions, please reach out to us. We're happy to help. And it's been a real pleasure. Thank you guys for having me on.
Thank you, Dr. Osar.
Thank you. It was awesome.
Thank you guys.
Thank you.
Bye-bye.
Thank you for joining.